Assalamu alaikum, the communication day. First scenario, you are the doctor in the medical ward. Mr. John, he's 45 years old, has been admitted with fever, dysuria, and flank pain. At that time, there were multiple admissions. He received one dose of insulin by mistake, as his first name has been mixed up with another patient. Fortunately, the event has been picked up early, and the consultant recommended for 1 hourly check of his blood sugar. Your task is to discuss this with him, what happened exactly, further management plan, and address his concerns. Are you ready to start?
Okay. Hello,
Hello.
I'm Dr. Najim, one of the doctor in the medical ward today. Are you Mr. John, 45 years old?
Yes, doctor.
Okay, nice to meet you, Mr. John.
Nice to meet you.
We are here today to discuss some issue about your health condition. It's okay with you?
Yes, doctor, no problem.
Okay, Mr. John, you can tell me how you feeling now?
Actually, doctor, I'm feeling little better. They give me painkillers. I think my temperature is going down now, and the pain also is improving.
Okay, it's good. You improve. Okay, Mr. John, you can tell me what you know about your condition?
Yeah, I had this high temperature, doctor, for like 2 days. Then I developed like painful micturition and this tummy pain. Then I came here to the hospital. They admitted me and they told me that maybe I have kidney infection, and they will give me some antibiotics and they will run blood tests and imaging for me.
Okay. Okay,
Yeah.
Mr. John. Okay, Mr. John, I want to discuss with you some issue happening yesterday. Okay.
Okay.
There is a mistake happening, Mr. John. There is one nurse by mistake. She give you one dose of insulin. I'm sorry for that, Mr. John, but this is what's happening. Okay.
Insulin?
You're right. Yes.
This medicine for
This is
diabetes, doctor?
yes. This is the medicine for diabetic, and I'm sorry
Yes,
to
doctor,
tell
but
you.
I don't have diabetes.
I know, Mr. John, you not have diabetic. There is mistake happening yesterday. This
Okay.
medication given to you by mistake. I'm sorry. I'm sorry to tell you that. And I apologize behalf all the medical team, okay, for this mistake.
Okay.
Okay, the good thing we catch this problem early, okay, and we know there is mistake happening because the name it's same for another patient who's must take that insulin. For that, this mistake happening. Again, I'm sorry, Mr. John, and I apologize again behalf all the medical team, okay, for this mistake.
Okay, doctor, but is it dangerous or what?
See, Mr. John, the insulin given for the patient who's half diabetic because the level
Yeah.
of the glucose in the blood high. For that, it decreases the glucose in the blood for the patient with diabetic. But in the patient without diabetic, I'm sorry to tell you, it can cause drop in the glucose, and the patient there is some symptom came with this drop of the glucose, like sweating, confusion, cold extremity.
Oh,
I'm sorry
really?
again, Mr. John. Yes, Mr. John.
So I can have these symptoms?
No, Mr. John, because we know this mistake early, and we now give you the medication to increase the blood glucose, and we keep you under observation, and we will check your blood glucose hourly, okay? For that, nothing will happening for you because you are under our care. Okay, Mr. John?
But how come, doctor? How come they are allowed to give me such medicine by that mistake? This is very disturbing, doctor.
I appreciate your concern, Mr. John, and I know how much this is bad for you, and we not accepted this also. For that, Mr. John, we will take this problem seriously, and we will send incidental report about this, about what's happening. Okay, because we not want this situation happening with another patient, Mr. John. We will take this seriously, and we will discuss this issue in the meeting in the morning with the medical team to know where is the problem and what the situation that's time. Okay, and why there is a system failure and where is the defect in our system. Okay, Mr. John.
Doctor, I want to know the name of the person who gave me that insulin.
I appreciate your concern, Mr. John, but as I told you, this is not the mistake of only one doctor or one nurse. This is the responsibility of the medical team who's follow you.
Yes,
Okay?
doctor, but this is negligence, doctor. I cannot
I'm
tolerate this. I want to do complaint, doctor.
Okay, I'm sorry. Okay, I appreciate your concern, Mr. John, but I want to tell you, I'm sorry, this is not negligent, this is mistake, okay? No one in the medical team want to harm you, Mr. John. Okay, I'm sorry, and I apologize again because we have all the team, but this is can happening because sometimes the name it's same for that this happening. But as I told you, we will do
How come
the.
this can happen, doctor? How come you are dealing with people like this? So this is normal to harm people for you?
I'm sorry, I appreciate your concern, Mr. John. We not harm the patient, Mr. John. But I told you there is some defect in our system. We not exactly know what's happening, exactly what the situation of this. For that, we need
And
to
what about
discuss
the other
this
patient,
issue
doctor?
in
What about the
the
patient
meeting.
that he didn't receive his medicine? What, he will suffer also?
I appreciate your concern, Mr. John. Mr. John, I told you we take this seriously. We not ignore this, and we will discuss this. I will send incidental report to know what the situation and where is the defect in our system and why this happening. Okay, Mr. John. Any another concern, Mr. John?
Yes, doctor, I want to be discharged. I will not stay in that hospital, doctor, with this negligence. I will not stay.
I'm sorry, Mr. John.
How
For
can I trust your care, doctor? I want to be discharged.
Okay, I'm sorry, Mr. John, for your feeling like this. But Mr. John, I told you this is a mistake. We all here know it's a mistake and we apologize for you. Okay, Mr. John.
Yes, doctor,
And
but I insist. I want to be discharged, please.
Mr. John, you are improved in the treatment, and now you are okay. We follow you every hour, hourly, to check your blood and glucose in your blood. Okay, Mr. John. And also, if you go in another hospital, they will do same as we do now, Mr. John.
So you will keep me against my will, doctor? You will keep me here against my will?
And Mr. John, I want to only I informed you what's happening because we not want this happening again, and we not want another patient also suffering as you. I'm sorry for that, Mr. John, for what's happening for you. For that, I informed you what's exactly what's happening, Mr. John. But I tell you, and you are now under our care. We observe you, and we check your glucose hourly. For that, if you go to if you go home and under another, if you go to another hospital also, they will do the same. They will check you for your glucose
Sorry,
and
doctor,
will
I want
keep
to
you
be
under.
discharged. I want to go out. I will not stay in that hospital.
Okay, Mr. John, I give you time to thinking, and I want
I don't
to
want time
arrange
to
for
think,
you
doctor. I don't want time. I want
one.
to be discharged now, doctor, please.
Okay, Mr. John, I can arrange a meeting with the consultant to discuss this issue with him. It's okay with you, Mr. John?
No, doctor, it's not okay. I want to be discharged.
Mr. John, uh, I'm sorry. Really, I know how. I know, and I really appreciate your feeling, and anyone in your situation can do same. Nobody accepted this mistake, okay, Mr. John. But I want you to thinking again, and we will arrange you a meeting to discuss and know what we will
I
do
don't want another
exactly.
meeting, doctor. I want to be discharged from the hospital.
Okay, Mr. John. But we need, Mr. John, if you want to go home, you must sign one paper. This is your responsibility to go home because you not finish your treatment, Mr. John. We still not finished treatment. The main problem you came with it, that's problem of the urine and dysuria, Mr. John.
I don't mind, doctor. I will sign any paper you give me. No problem for me.
Okay, Mr. John, I want to inform you. Also, if you want to go, we will give you the medication. We will give you the medication and we will teach you how you use this medication. And also we will give you the appointment to follow with us. Okay, Mr. John. And I will inform you about the incident report which we send, what's happening. Okay, Mr. John.
Okay, doctor.
I'm
Okay,
sorry again, Mr. John, and thank you for you.
perfect.
Okay, doctor.
Perfect. Thank you, Dr. Huda. Well done. I added 1 minute for the last solution you have to offer. And you did it finally.
Yeah.
Yeah, finally. You
Yeah.
should do.
Yeah. Yeah.
It's
Yeah.
not against his sake, right? Nothing will happen because you already managed and you control it. And he's
Yeah.
insisting. You did everything to convince, but still he's insisting. Let's hear the comment from Dr. Ala, then I will comment. Please, Dr. Ala.
Dr. Hoda, you did very well. You covered almost everything. Only small things only. Actually, the introduction very good. But you told that this event happened yesterday. It's not happened yesterday. The patient just the event just happened, and they are planning to follow the blood sugar hourly. That's why there is a risk of hypoglycemia that the insulin has been given recently. Okay. Also, you told
Okay.
that it's not that big, but you told that one nurse gave you. I think it's better to tell like you have received that medicine like this. No need to mention like the nurse gave you the medicine. Okay.
Okay. Okay.
The other
Okay.
thing, you explained the side effect of the insulin, but I think you didn't mention all the side effects like the sweat, the hunger pain, the tremors, and also like to warn the patient from any of these side effects if happened anytime, like to take sweets or sugary food, and also to inform us directly. Beside this, we will follow you hourly also to monitor your blood sugar. You should inform him about all the complications that expected. Yes, the safety netting, all the complications that expected from the insulin. Also, the patient wants to do complain. You didn't direct him to the pathway how to do complain. Okay, how like to direct him
Yes.
to the patient advice liaison service. Okay, and you told us this is not negligence. This is a mistake.
Yes.
Like
Because
yeah,
yes.
yeah. I don't know the difference exactly, but I think this is negligence also.
No, no, Dr. Ala, it's not negligence
Yeah.
because it's given by mistake. Negligence mean you intentionally didn't give the patient the insulin or you give the patient insulin intentionally. or the opposite. If the patient will receive medication, you didn't give him the medication intentionally, or
Mm.
the medication timing
But
comes and you didn't give the medication. All this considered as this scenario as a
I
mistake.
think
Yeah,
I think this is negligence also, because when someone give a medicine to any patient, he should do identification of the patient. That's why maybe he didn't do the proper identification, so he gave the wrong medicine to the wrong patient.
again, it's not considered as negligence, medical error only.
Okay,
Okay, it's called medical error or mistake in
medical
medicine.
error.
Yes.
Yeah.
So again, you finished the comment? Anything else?
This incident report is like jargon, or
No, no, no. It's
it's
an
not.
incident report should be done or raised, and you
Yeah,
can explain to him what is the incident report. So you will mention or you will say the word, any medical word you mention as jargon, but later on explain it. It's a report. We usually do it whenever the mistakes or some.
explain. Yeah, yeah.
Yes,
Yes, yeah.
but by the name you have
That's
to
what I meant. That it's a jargon, so we should explain it. Like
exactly.
this is a document that we are filing. Then we
Yes,
raise the issue to the consultant and also to the nursing supervisor to discuss
exactly.
what happening exactly and prevent this from happening again.
Yes,
Uh, the other thing, he insisted to be discharged, and you took too much time, okay, trying
exactly.
to convince him and explaining that the same management will be done outside. Also, you didn't inform him the risk of being discharged with that he received insulin and the risk of hypoglycemia on his way. And also, you should have asked him how he will go out, he will drive, or who,
Okay.
uh, yeah,
Okay.
yeah, like this.
Yes,
Otherwise, I think you covered everything about the medical error, like the admitting the mistake, apologizing, the action that should have been given, explaining what the event in details. Okay, you covered everything, I think.
yes. Add to them only root cause analysis, which the team they should investigate to know the bottom of this problem, why it happened. Okay,
Okay.
Yes.
Okay.
to find out why this happened. Is it some technical error, medication, pharmacy, or just human error? Anyway, we intentionally, it's not intentionally. You have to mention this, please. Remember, whenever you have medical error or mistake, you can or you have to say to the patient, it's unintentionally happened. Okay, we didn't do it intentionally. So the mistakes happen, right? And one of these mistakes, what happened with you, and be sure this is not intentionally. Why? Because you have to remove any negligence issue from the point, as Dr. Ala said. So he will suspect that you are doing that because of your less care or carelessness. No, she did it by mistake. Totally, it was mistakenly given to you instead of another patient because of mixing the names. Okay.
Okay.
By the way, this is
Okay.
one of the very famous scenarios in every diet in every center. It comes as a mistake always. Given mistake either by mistake, given insulin by mistake or given to another patient instead of others, or given high dose or given wrong insulin type. It comes by everywhere. The
Okay.
second point, the introduction was very good. When you ask him, how do you feel now? I like when you ask, but be sure about the event timing, when that happened, because you said yesterday, as Dr. Ala mentioned, it was just today, and it will be different now for the management plan. Why? If yesterday, so 24
I
hours observation can be finished and he can be discharged. But if today, he should be still under observation for 24 hours. So the decision of being discharged against medical advice here will be differ. Why? Because he will be at risk to have the hypoglycemia again. But if he
okay.
since yesterday, so I can even let him sign the paper for them and he can leave. Anyway, any patient insisting to do something in a scenario, particularly communication, be sure that it is his right and it is his right. Be sure that you can do it under his responsibility. So the solution for Dama here is okay to offer. Okay.
Okay. Okay.
Yeah, otherwise, I think the tone of your voice very good, sympathetic, empathetic. The apology from the start is a must. You have to do it since the admission of the mistake. So acknowledge and admit the mistake. At the same time, apologize on the all or on behalf of the whole team, and be
Okay.
sure this is not intentionally. And always we are doing the best way while confirming the medication, but sometimes the mistake happen even with the confirming the data. Okay, so you
Okay.
have to reassure him, and this service or this quality of service always being improved after this investigation. We are doing
Okay.
this investigation to improve the service offered for you and other patient. That's why we are raising the issue. The second point is whenever he asks you to complain, you have to reassure him again. If even if you are complaining, be sure that the quality of service and the care will not be affected by this complaint. Okay.
Okay.
Any
Okay.
other
Okay.
comment
Thank you.
or question, Dr. Huda, for this scenario?
I want to ask in the end, I can arrange meeting with the consultant if he
Yes,
insisting for
what you did
DAMA.
exactly, what you did exactly right. So the stepwise manner will be first, you will convince him, you will tell him about the risk and the harm if he discharge. Then he insists again, okay, I will arrange a meeting with consultant. He's in better position to convince you. Still, he's insisting. Now the time, okay, we have a form called discharge against medical advice paper. You have to sign it, and your discharge will be upon your responsibility. And give him the safety netting. It's very important. Please, Mr. John, whenever you feel these things, visit us or call us immediately or even seek medical advice. As Dr. Ala said, sweating, hunger pain, or feeling drowsy or unaware. Even you can inform your partner at home that he should bring you to the hospital immediately. He might go to a coma without noticed. Okay? Suppose he will
Okay.
feel it because
Okay.
he's not
Okay.
diabetic patient, so he will feel the hypoglycemic symptoms. But for the more care and precaution, you will inform the partner with you at home just to bring you whenever you feel these symptoms because you don't know what the sequel will happen. He might have these symptoms and progressively worsen, and he might proceed to coma. So who will bring him? No one. That's why. Did you ask about with whom you're living?
No, so I forget. Yes.
Yeah. So with whom you're living is very
Yes.
important. Why? Because he will go home and he should be observed by someone, right?
Yes.
So
Yes.
this one will bring him home. Sorry, he will bring him to the hospital. He will bring him to the hospital after he's feeling these symptoms, for example. So he should be under observation of someone which is or who is living with him at home. This is a very important question to ask about with whom you're living. The job, did you ask the
Yes.
job? Some social history?
I don't know, doctor, because
Yeah,
some mentors said if medical error, we not ask about the social. I don't know. For that, I am not ask. I don't
okay.
know.
Okay. Let's see, let's assume, of course, if you have time. Should you ask?
Okay.
I will ask you now. Should you ask if you have time? I believe this scenario,
If
Dr. Ala, give you a lot of concerns, and he didn't give you chance to ask him about the social and the support. But if you have the time, I will ask you now. Should
I
you
will,
ask this question? What do you think?
I will ask. Really, if there is time, I will ask.
Yeah, it makes sense to ask about the alcohol smoking. This patient will come back either with what he has earlier, for example, UTI, because of frequent or smoking. It might harm the general health. Of course, it's not direct in this scenario, but you have to advise anyone smoking about the general health related to the smoking. It might be harmed. So you have to ask even within 20 seconds, do you smoke? Do you drink alcohol? What about the alcohol in this scenario? Do you think it's important to raise it?
Yes, it's cause also hypoglycemia.
Exactly. So you have to raise
Sometimes,
it. The job, finally, the job. If this patient, for example, working in hard work in the sun, for example, and he will again he will have hypoglycemia because of maybe delayed effect of the insulin or indirect way he didn't eat well, but still there is some insulin. However, his kidney supposed to be normal. Okay, in this scenario, his kidney function supposed to be normal, so no delayed effect of insulin. But for at least for the last or for the next 20 or 48 hours, he shouldn't go to his work, right? So the job
okay,
should be postponed till he will be totally free of the hypoglycemic event. And I believe in every
okay,
scenario, if you have time, do you smoke, do you drink alcohol, as well as the driving in this scenario is very important. Who will drive you home? He's still under
yes,
effect of insulin, right? So it's important to
yes,
ask if he will drive, he shouldn't do. But be sure
okay,
that if the surrogate give you a lot of concern, he didn't give you time to address these issues, the social and personal history, be sure it's instructed by the examiner. So the examiner will tell you, give him all this concern. Whenever you have the chance to raise this issue, you can do it. Otherwise, you did what you have to do. Clear?
okay, okay, doctor.
Okay. Please, can you post your scenario for Dr. Ala? I will read the comment quickly. As first, yeah, ask Farid how you feel now. She asked earlier. Thank you for this comment, Dr. Maida. She asked him on the introduction. As the duty or as my duty of care, I am here to discuss an incident of mistaken insulin was given. Yes, she did that at the medical error. Dr. Tahani, yes, vaccinating. Okay, anyone with comment? Dr. Maida, you want to add anything? If you are attending.
Yes, she did very well. The only thing that to convince this patient, I mean, like this patient now he want to go home. First, we can say like this is completely your right. You can decide to stay or to go home. We can't stop you from doing that. But at the same time, it's my duty to tell you about the
The
dangerous
risk.
of
Oh, yeah.
or the risk of going home while you are taking this insulin dose. Then you mentioned for him the side effect of the medication, the insulin, that if you as you take this dose of insulin, it can cause dizziness, whatever. You mentioned all the insulin side effects, and if this has happened and your sugar lowered down, it may even cause coma and death. And for that reason, we need to keep you in the hospital to monitor your symptoms, and we make sure that you are free from this until the insulin it's have half life. Until the half life of this insulin has been uh, completed and you are free from that insulin in your body, then it is safe to go home. However, if you insist to go home, still you can make sure that you are eating and drinking. Make sure that if you, I mean, like to tell him how to monitor at home, even if he like insists to go home.
Yes.
Yeah, I mean, this is the way how to first to tell him that this is his right. We are okay with that, but the only thing that you need to understand your decision. What does that mean? Yeah, how? What is it? What is your decision means? You need to
Yes.
understand exactly what is the side effect of the what is the bad if this has happened. And
Yes.
then if the patient after that he understand, you make sure that he understand the risk of going home against medical advice. Then we can say to him, as far as you don't want to stay in the hospital and you want to discharge yourself against our advice, we have a form you need to complete. Then we give him this form if he is insisted. but we first make sure that he understands his decision.
Yes.
Yes, how much it's serious. Yes,
To leave the
yes,
hospital. Yes. Yes.
yes. Thank you, Doctor.
Okay. Thank you, Dr.
Dr.
Maida.
Bertrand,
Yes.
possibly, if the candidate, he will not tell the patient that how you will go home. Do you want anyone to drive you?
Yes.
Maybe he take 0 from 4 in clinical judgment.
Why?
Because yeah, it is a small sentence, but it can damage the clinical judgment at all. Because patient liable for hypoglycemia and he can do accident.
Yeah. You mean
In
you should offer,
exam,
right?
yes, in my exam, the patient this my question for you.
Uh-huh.
In my exam, multiple sclerosis, and the patient has symptoms other than eye vision. There is no problem in the vision. I did
Okay.
not tell the patient to stop driving, and he gave me 0 in clinical judgment because I did not stop the patient from the.
Yes. Okay.
Despite the patient has no symptoms about, I
Okay.
don't know.
I will tell you now. Do you think is there any possibility the multiple sclerosis next time will be occur in as eye symptom? You have any guarantee, Dr. Mahi?
No, no.
So no guarantee. So in
Possibly
this
he
case,
can. Possibly the
yes,
next track
possibly.
may he has. Yes, yes.
I
Possible.
agree. I agree. Maybe this is the examiner concept, and you can also respect that for the welfare of the patient. Any multiple sclerosis or any patient with disease might, I didn't say it will, it might come, means there is possibility, even 1%. So please address the driving issue. Even if you ask him or ask her about driving once and you advise her that you should stop driving, I think you can get the good mark. Anyway, I don't think it's the only point he give you this mark on it. Maybe something else you judge on it, and he make
He
the
write in the
decision.
feedback.
Okay, he
He,
write
he write in the feedback.
both
Yes.
examiner they
Uh,
commented on.
he did not stop the patient from driving.
Yeah, so this is the lesson from any multiple sclerosis scenario, to stop driving for any reason, even the patient is not having any vision symptoms. Why? Because in PACES, by the way, Dr. Mahi, in PACES, I don't think there is a lot of disease affecting the vision apart from multiple sclerosis. Myasthenia gravis, I think, also can lead to double vision. I don't think, yeah, hyperthyroidism, thyrotoxicosis. I mean, it's only you can count in one hand how many conditions in paces you have to advise regarding the driving. I think so. So, whatever the decision, forget about the mark, but learn the lesson. We have to learn the lesson. We don't know also every examiner, every situation, every center, they are different. Maybe in another center, they can accept this issue because the no eye vision symptoms, and he can give you borderline. But it depends on the examiner wish. Whatever they want, they will do. Unfortunately, we cannot interfere. Even with the appeal, it will not change anything. I'm so sorry, Dr. Mahi. I know you are still disappointed from this exam. I agree, and I believe you are one of the best doctors practice in these sessions. But this is the life. It will not give you what you want always. Okay, so forget about it. Just learn the lesson and the take-home message from this scenario and your scenario. And whenever there is vision issue, advise the patient to stop driving immediately and temporarily. Whenever he will resume the driving, it's not your job now. Just stop his driving, be safe, and get the mark for the welfare. Suppose this mark to be with the welfare. I don't know why they put it in the clinical judgment, but I think they are toxic examiners, so forget about them. Uh, Thank you, Dr. Mahi. You have any question else? And welcome
No,
back,
no,
Dr.
no.
Mahi.
Thank you.
Welcome back. Thank you.
Thank you.
Okay, Dr. Al-Huda scenario for Dr. Ala. Mr. Smith, 30 years old, admitted with a change level of concentration and or conscious level, I'm not sure, and diagnosed as meningococcal meningitis. Isolated, and he is isolated. Please talk to the father, Mr. John, about the diagnosis and management plan and prognosis. Dr. Ala, I think you read the scenario earlier, so I can give you 1 minute, or if you are ready, we can start instantly.
I'm ready already, Dr. Bassem.
Perfect. Okay. So the conscious level, not concentration. This is conscious level. Let's start. Here you go.
Okay, hello, I am Dr. Mitwalli. I'm the medical doctor in the ward today. Sorry, you are the father for Mr. Smith, 30 years old. Can I know what's your name, please?
Yes, I'm John.
Hello,
I'm father
Mr. John.
of Smith. Yes.
Hello, Mr. John. Nice to meet you. Mr.
Him.
John, you are the next of kin for Mr. Smith.
Yes, doctor.
Okay, Mr. John. Mr. John, we are here today to discuss about the condition of Mr. Smith and our management plan for him. Is that all right?
Yes, doctor. I want to talk with somebody. Yes.
Yeah, I'm here to reply also for your questions and concern. So, Mr. John, before I proceed further, can you tell me how much you know about his condition?
I don't know, doctor. My son, he's healthy, but since 5 days he have fever. Then he's become and he's not. He start become confused. I don't know, doctor, what's happening for him. I bring him to the hospital. I don't know. He have a stroke or what's happening for him, doctor.
I appreciate your concern, Mr. John, and understand your feelings. Actually, Mr. Smith doesn't have stroke, okay? But what he has what we are calling meningococcal meningitis. Excuse me for the medical term. This is a bug infection causing like soreness in the covering layers of the brain. That's why he had that fever and also change in his consciousness.
Oh my God,
Uh,
doctor. It is serious?
Actually,
Serious? Yes.
Mr. John, it can be serious if not treated early.
Oh my God. Oh my God, doctor. Okay.
So I understand your feelings, Mr. John. So as I mentioned to you, this is a bug infection to the layers covering the brain. So that's why we admitted Mr. Smith and we put him in isolation because this bug infection is infectious, so it can spread to other. And we give him the antibiotics to try to get rid of this bug infection. Okay, this infection
Hey,
of the layers.
doctor. I want to ask, I can stay with him?
Actually, Mr. John, it's difficult to stay with him. As I mentioned to you, this type of infection is infectious and it can be easily spread to others. That's why we are putting him in a side room, but you can check him from outside through the glass.
You mean I cannot see him? I
You
cannot
can see
go
him
in?
from outside. You can see him from outside. And also sometimes you can apply for you some protective clothing, but also it will be difficult to be close to him because as I mentioned to you, this type of infection will it can be easily spread to others. If you want me, I can explain to you more also about the disease that he has.
Okay, doctor.
As I mentioned to you, it's causing this inflammation of the layers covering the brain. That's a cause of the fever and also that the change in his conscious level. And also sometimes this infection can cause weakness in any part of the body and sometimes also can result in a coma and also can increase the pressure inside the brain. And as I mentioned to you, it can be dangerous if not treated early. So the treatment of this disease is to give him the proper antibiotic, okay, to cover the probable type of infection that caused this type of infection. We already did for him sampling from the fluid around his brain, and we will do what we are calling culture to check the type of infection that he has to give to narrow down the proper antibiotic to give him. But we are already now giving him the antibiotics which covering the most probable types of infection. Meningococcus. Sorry. So the type of infection, as I mentioned, this is meningococcus, and we are giving him the proper antibiotic. Are you following me, Mr. John?
Yes, doctor. For how much he will stay in this room alone? I can take him to the home and I keep him in the special room for him in the home also.
As I mentioned to you, Mr. John, it's difficult for him to go home. He should stay at the hospital in isolation room, and also the medication that we are giving him should be given in the hospital. It will be difficult to be given at the home.
Okay, doctor, you told me it is serious. My son, he will come back like before, normally like before.
I appreciate your concerns, Mr. John. I cannot promise like this, but we will do our best to treat him and to help him recover back as normal. And any updates about his condition, we will inform you also about it. You have any other concerns,
Okay.
Mr. John?
Okay,
Mr.
doctor.
John. Mr. John,
Yes.
so as I mentioned to you, this type of infection that he has, it's easily spread to others. So what we are going to do, we need also to know the close contacts of Mr. Smith to give them the proper treatment to prevent this infection from affecting them. So, and also if anyone was close to him the previous days, and he had any fever or any problem in awareness, we should come directly to the hospital also to receive the proper treatment.
Okay. Okay, doctor.
Okay, Mr. John.
Okay, doctor.
Okay, Mr. John. So, Mr. John, can I ask you about Mr. Smith, what he's doing for living? What's his job?
He's teacher, doctor.
Okay, Mr. John. Is he married?
Yes, he has also 3 children.
Okay, and how is the children, how they are now, and also how is his wife?
They are okay, but I don't know later what's will happening. But till now, they are okay.
Okay, so we need to also, as I mentioned, we need to bring them to give them this medicine to prevent them from getting the infection. And also, you were close contact also with Mr. Smith.
Yes, doctor.
So also we will give you this medicine. This medicine is given by mouth. You will receive this medicine 2 times per day for 2 days. This to prevent you from getting that infection, because as I mentioned to you, this is serious infection. So it's better to receive this medicine to prevent you from getting that infection.
Okay, doctor. Doctor,
Is that
I
okay?
want to ask, yes, but I want to ask how much time he need for treated in the hospital?
Actually, Mr. John will give him treatment like for 2 weeks until we make sure that his infection is resolved. And as I told you, we'll keep close monitoring on him.
Okay.
Is that
Thank you,
okay?
doctor.
Do you have any other concerns?
No, thank you, doctor.
So, Mr. John, also I will give you some leaflets, brochures, and also some website to know more about this meningococcus meningitis. And also, if you have any worries or queries, don't hesitate to contact us to give you the proper information.
Okay, thank you, doctor.
Thank you,
Thank
and
you.
I'm sorry for this news today. I hope Mr. Smith will improve in this condition also to get better.
Okay, thank you, doctor. Thank you.
Thank you, Mr. John.
Okay, time is up. On time. Thank you, Dr. Ara. Well done. Let's hear
Thank
Dr.
you. I got confused in the middle only.
Yes, I will tell you about your mistake, but later on, after Dr. Huda comment. But well done in general.
Yes. He covered most of the he explained the disease and explained also the sign and the prognosis. And also he talked about the complication. The complication, this patient maybe become disabled, and maybe he has hearing loss and cognitive problem in the future. Okay, but we tell him also if because we catch this disease from early, maybe we can cure him. He talk about the family and what we must do for family, okay, and give also safety netting, because if they complain from fever or anything, they must directly go to the hospital. Mashallah, he's cover all, really.
Yes. Okay, thank you, Dr. Huda. Yes, I think Dr. Ala did it perfect. I agree. And the introduction was good. The next of kin, all this you should ask because the patient already, this is the father, so the patient is comatose. If you want, you can even invite someone because the patient is confused, so he lost the capacity. Anyway, if you don't invite, it's okay. But the most important point here, I believe you have to do the Breaking Bad news way. Warning shot and golden silence. Whenever you mention he has a condition called meningococcal meningitis, have you ever heard about it? And be quiet for a while. Of course, he will be shocked because the name looks complicated. Now the time to explain. Okay, and you can support in between. Do you need any support? Are you okay? And always, whenever she asks about concern, you can appreciate. You can say, I can see how much you are worried about him. I understand it's difficult to hear all this news. Okay, not to answer the question immediately. The second point, which I think here it's risky to do, the adding information from yourself that you did the lumbar puncture and it was showing organism, or we are waiting for the organism to be cultured. As long as nothing mentioned in the scenario, please don't add even logic or scientifically supposed to be done. Of course, they give these antibiotics after confirming the diagnosis, either clinically or
Yeah,
laboratory.
the problem that he's already diagnosed with meningococcal
Exactly.
meningitis.
That's
Yeah,
why sometimes
yeah.
sometimes we are trying to make the things more explained, but the more explanation, the more mistakes. Yes, it's already diagnosed. No need to mention I will downgrade the antibiotics. I will narrow the antibiotics. It's not my task now. My task is to explain the condition. You did it well, the manifestation of the disease, but I preferred also to add the deafness he might have, and you have to mention the most serious, as you did. Coma or confusion, this is the most serious, as well as the seizure. For that, we admit him in isolation room, or which we call it a side room. In the first couple of days, he should be in this room, and we will restrict the visitors. As you said exactly, you can see him from outside from the glass. If you want to be inside for a while, you have to do the precaution and you can proceed in. But be sure that we will restrict the visiting time with him in order not to spread the infection. Okay, so you address these points till now, okay. But away from the part of narrowing, we did the lumbar puncture. If they wrote for you lumbar puncture, you have to use it. If not, don't talk about it. Okay, so whenever written in the scenario or whatever written in the scenario, you can use, but extra information will be dangerous to mention. Okay, back to the isolation, you did it well. The screening, you did well, but you didn't notify, right? So you have to mention the infection control team. However, you already offer the medication for him and for the close contact, but it's not your job. So you can refer him to the infection control team as well as we notify the disease because it's one of the notifiable disease. They should follow and you should screen the close contact even in the hospital. Sorry, not in the hospital, in the school, because his job was teacher. So he had a contact with some children, and you know the children very weak in the immunity, they should be screened. However, any patient or sorry, any relative or any family member have any of these symptoms, please bring them immediately to the emergency. Plus, yeah, they might take a medication which is called prophylactic antibiotics in order not to have these symptoms, okay, or to have this infection. The support, yes, who's living with him or who's dependent on him, you have to offer support. Why? Because this patient might spend longer in the hospital, but you didn't ask about who's supporting them, right? Who's living with him? The wife and the children. And who's supporting them now? Of course, he's the one working at home and they are dependent on him. But who's helping them now? You have to offer some help here. Okay? Otherwise, I don't think you miss anything else. Perfect, Dr. Ala. I believe you did it well. So you can get a good mark in this scenario. Okay, you have
Thank
any?
you, Dr. Basil. Yeah,
Yes.
about the question that he told that I can take him to the home and I put him in separate
Yeah,
room like that.
good answer. The medication given to him now is need to be given through the blood channel and to be monitored. Some patients might be in coma and you cannot manage the coma at home. It's difficult to be
Fits,
managed at home. Sorry?
fits if they have fits.
Exactly, plus seizure. He should be in isolation room under close monitoring. Why? Because most of these conditions might proceed or might progress to coma or even seizure. So it's difficult to handle these things at home. It's not a matter of medication only. The close observation and further complication should be picked up. The good thing, as you said, early discovery of the disease might give good outcome. And of course, the young patients. However, it's not a rule. Some patient might proceed and progress into a coma or seizure, whatever their age. But be sure that the early discover help him for the cure. Okay, Dr. Abdallah. Any other question,
Okay,
Dr. Abdallah?
thank you, Dr. Basil. Thank you.
Most welcome. Most welcome. Any question, Dr. Al Huda?
Thank you, doctor.
Okay, well done, both of you today as a couple. Really, you did perfect, both of you. The scenarios also is good and famous scenarios. You have to train on it. Let me read the comments. Yeah, Dr. Maida again about the breaking bad news. I used to say breaking bad news and to use it whenever the patient recovery or the prognosis or the outcome will be poor prognosis. In this condition, he's confused means the titer of the bug inside his CSF is high. So the prognosis will dependent on the manifestation. Even he received the medication early. Still the confusion and the coma put him as an outcome poor. Again, this is my opinion regarding breaking bad news. Any disease might lead to serious condition or serious complication. I should use it as breaking bad news. One of them, meningococcal meningitis, even motor neuron disease, or stroke. Why? Because you don't know what will happen in the future. Is this patient or will this patient recover fully? You don't have any guarantee. Even you are giving the all medication. Okay. Um, because most patients respond well, I agree they respond, but even you said most of, not all of. More minority develop complications. So you answer your question by yourself. And what I said before reading your comment, the minority, you don't know if this patient might be from the minority part. You don't have any guarantee that he will be of the majority part. So you have to give the bad news or break bad news. You don't know what the percentage of the recovery of this patient. Why? Because in the future, if this patient recover, good and great. If not recovered, the father will blame on you. You said he will recover. Even he was of the 1% or one of the minority part or group. Still, you give him false hope and the breaking bad news always with the bad news. For me, this is bad news, should be breakdown. Okay? Any
But
comment? Yes. Okay.
Dr. Basim, like
Yeah.
we will start like I don't have good news for you today or
Okay.
like this.
Yes. Yes.
Mm. Sorry, I'm just because this is dilemma of whatever there is a high percentage of any disease, because you don't guarantee for any disease, even if the patient have like upper respiratory tract infection. Some people may have a problem. So whatever there is a high percentage, we give a hope. We give a hope, and still we give a window that it's maybe what I will say, like this bug in the affected the lining of whatever of the brain and everything, and this we have the now he started the antibiotic. Most of the patients will normally recover from this bug infection when they have the right antibiotic, but still there is minority. They may develop complication, and then I mentioned the complication. At the moment, your son is confused, and we will monitor him in the next few hours, or for few hours, few days, and we'll see how he's respond. So you give the father that this patient, he may have complication. We don't know the outcome, but still we have a great hope.
Okay,
That's
I
why.
didn't. Yeah, but I didn't talk about the great hope. Yeah, there is hope, but I
I
think
mean, if you break in bad, it's not a
okay.
bad news for me.
So
This is not breaking bad news. This is,
okay,
I will tell him about the disease. This is the disease, and it is acute infection, and this is infection have a treatment, and most of the patients will respond to this treatment. Minority may not respond because this is the normal for any disease, that some people respond well, some people not respond, some people will develop
okay,
complication of a disease, some people make complication of medication. It is the medicine. This is medicine. It is like that. Something can go right way, something can go it may be the wrong direction. However, most of the patient respond well. We have a percentage, so we'll go with that. This is the normal, and if something happened abnormal, still we have this window.
okay. What I will ask you now, Christian? What the harm if I break bad news about this condition? What will happen?
Because you will give a big, it's miscommunication. This is what will happen. This is miscommunication, that you are giving like you prepare the father for a very huge, you give a very huge way of giving, to give a news for something. It may be resolved in 1 to 2 days, because most of the patients, they come confused in the first day, second day they will become well. This is the normal.
Yes,
But if this is happen because it's acute, normally breaking bad news for the bad news.
What do you think? This patient is he in bad
If anyone
situation?
anyone come to the hospital, it is a bad news.
Exactly.
If we start like
Particularly
this,
if this
this
conscious
will
level
not.
affected.
No, if we will start like this, we'll never give any
No, no,
news
no,
for
no.
any
Not
patient.
not every condition, Dr. Maida. I didn't do that with every condition. I do it with the progression or the disease with good or
Yeah,
with.
so the bad news for a disease that have poor
Okay,
outcome,
exactly.
disabling disease, disease that can end. The patient will be dying, dying patient have a cancer,
Okay,
have a disease like MS, have a disease,
okay,
whatever. The majority of the patient will end in a way, in not good way, or have a poor outcome anyway.
yes.
And there is a little, and the minority will be okay. But if the majority have the good prognosis, why I give bad news?
Okay. How
This is my
guarantee with?
concern.
Yeah, yeah. I
No, no,
know,
but
I know.
and what your guarantee he will not be well. So
Yeah, but at
because
least
yeah,
my
that's
concept,
what.
Dr. Maida, my
Mm.
concept, at least the family will not ask you and blame you why you told me he will be fine, but he's
I'm
now
not
in
telling
coma.
like you he will be fine. I'm telling that the disease just
Yeah, the way of not breaking bad news means,
exactly the way Dr. Ala did. I will tell there is a disease, there is infection in the whatever in the brain, and this is infection. Now we caught it early, and he started the antibiotic, and the antibiotic. Most of the patient responding well to this antibiotic, and. To the antibiotic. However, still there is some people are not responding. So if the patient is not responding, they know that. I told them that there is minority.
okay, let's talk about PACE's exam way. If there is scenario need to be breaking bad news, golden silence, and warning shot, they will minus you if you didn't do so. Leave or forget about the reality, about the practice. Yeah, sometimes you are giving hope by saying this, but what I'm talking about in paces wise, if there is acute and severe condition that might lead to coma or confusion or even seizure, I should break it as bad news to show the examiner that I use the way of breaking bad news. Again, it depends about the examiner and everyone and his approach. This is my way to do. Anyone convinced with it, it's okay. If someone, yeah, yes, he's not convinced and he doesn't want to do it, and let's see the feedback. If anyone has feedback about meningitis, if not managed as breaking bad news and they minus him, please let us know because always we have this conflict. Always I'm saying breaking bad news and others, not only Dr. Maida, by the way. There's a lot of candidates thinking that I shouldn't break bad news. But again, I always prefer to do it as a breaking bad news. Anyway, we respect every opinion and let's see in the exam paces wise, anyone has the feedback, please let us know. Okay, thank you, Dr. Maida, for your opinion and your comment. Anyone has other comment or question? Anyone with comment? Dr. Tahani, yeah, so this is Dr. Tahani opinion. You mean this is breaking bad news scenario, right? Dr. Tahani? Okay,
Yes, it is breaking bad news.
okay. If we do vote in this session, 25 candidate, if we do vote for the, or 24, because I already vote for the breaking bad news, Dr. Tahani also with me. If we do vote for that, maybe we'll have half and half, 50 and 50, or 50%. I mean, so 12 and 12. So I cannot force, or I cannot say, please do this. This is my humble opinion always. I'm trying to guide, but if someone convinced with another opinion or he heard from another mentor, so he can follow or he can do whatever he is feeling comfortable with. Okay, so always feel your sense. This is my always advice. Feel your sense and follow it, and do whatever makes sense for you and to the examiner. hopefully I deliver the message. So anyone has other comments? I will not vote because if we don't vote, we will fight today.
Dr. Bassel,
Yes,
can
Dr.
I ask for notification of the
Yeah.
health agency
Yes.
for all the disease?
Not
For
all
what,
the
doctor?
disease.
Because
For
I need
notifiable
to
disease.
no,
There is a list
yes,
of
like
notifiable disease. Okay, one of them
yes, but
meningococcal
why
meningitis and
TB?
TB. Oh yes, exactly. This is the most common. HIV is not notifiable. Okay, be sure it's not notifiable. Some other infectious disease, like let's say about the sexual transmitted disease, you have to notify them. There is a big list: encephalitis, herpes zoster. There is,
Okay.
there is a list for the identifiable disease. I will send it back in the group just to
No,
refresh.
doctor, my question about
Yeah.
that's meaning this disease, I must screen the family. All this
Yes.
disease, okay. The notification
But
to screen the family. This is
not only the
the
family, the notification for the work, the place of work, the family, the close contact for the last week.
okay, yes, okay.
Okay.
Thank you, doctor.
Thank you, Dr. Huda. Any question? Thank you, Dr. Huda, again, Dr. Ala, Dr. Maida, of course, and Dr. Tahani, everyone
Thank you, Dr.
commented
Bassel.
today. Most welcome, Dr. Unfortunately, tomorrow I have social issue, so I will cancel tomorrow's session. So we'll not have the tomorrow session. We will do on Tuesday. I don't know to do the communication or to do the long, whatever suit for you, we will do. But we will postpone or we'll skip tomorrow's session. Okay. Anyone interested to practice on Tuesday? Message me privately. Thank you everyone for today's session. Okay. Before ending the session, Doctor, counseling on diagnosis. Yes, you should counsel. Who can be isolated at home? Dr. Samah. In cases, any patient with acute presentation, you cannot isolate him at home, right? Only situation you can, in cases wise, I'm talking about scenarios in cases, the patient can be isolated at home. It comes in cases TB, patient with TB, living alone, with no relatives, with weak immunity, with no children. He has ventilated room, okay? And he has private bathroom. He can deal with the family away, distance 1 meter at least. But in one occasion, the family members are adults and they have good immunity. No one of them is immunocompromised. After convincing the patient, you should convince the patient to stay at least, particularly the open TB person or patient, he should stay at least 2 weeks. If she or he insists, and you feel the scenario is going to the side of the insisting to go home, please assure about the things I mentioned. This is the role of isolating patient with TB. But in general, he should stay at hospital until finish the period of isolation. Is it clear, Dr. Samah? Yeah, so this is the only scenario in cases wise, talking about the isolation at home. Otherwise, I don't think there is a major issue or scenario to be isolated at home. Okay, so see you inshallah on Tuesday. Best of luck, good luck, and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you. Thank you, Dr. Nahla.